Welcome to the 8th Annual HealthCare Heroes Awards Breakfast. Of all the events we do each year, this is the one that's the most meaningful because of the nature of the work done each day by these deserving award recipients.
And for those of you being honored this morning through your passion and curiosity, you continue to advance the pace of change in healthcare and improve people's lives in our communities, and we thank you for that.
This is a group that recognizes that we have spent billions and billions and billions of dollars trying to understand the brain, and yet there's not a single disease of the brain that we can treat well. It's a pleasure to work with professionals that have decided to impact our community by developing improved medications.
We win every day. We win when kids learn not to leave 15 voicemails. We win when they learn how to begin a conversation with someone. We win when they make a friend. And then we win when their brain shows a shift in activity that's a more adjusted pattern of activity in their brains.
When I came to Milwaukee, my goal was to create a clinic really that allowed us to take good care for patients with sickle cell disease. We wanted them to receive some of the best care in the country. And then also we wanted to promote clinical research and have them have access to really outstanding clinical trials.
We have in this community a shared responsibility to improve the care of older adults and to provide the highest quality health care that respects patients' values, their preferences, and their expressed needs.
Our work is with the patient, and that's our reward. When a patient comes to my office and gives me a smile and a hug, and I know that this patient is feeling better, that's enough reward for me, and I'm committed to do it for the rest of my life.
There is the face-to-face direct care with victims, and there is all the ongoing work done behind the scenes that challenges us to create the most positive and effective response for those in our community affected by sexual abuse.
Our hope is, as we continue to move forward and partner into the school systems, is to continue to change children's lives, because that's how they're going to succeed. They can't see, they can't learn, they can't succeed. So that's our goal.
Unfortunately, in Milwaukee, there's a lot of hunger. Not only physical hunger, but needs. There's a lot of things that need to be addressed. And I do say that I take gladness or joy in being able to develop programs that will address those needs and help people come to health and wellness.
There is a scripture in the Bible. It says, to whom much is given, much is required. In my mind, that means for us to pay it forward. As much as I've been given, I like to bestow upon others. And so I believe that we are in a work that's more than just providing care, but it's providing ministry to people who's in need.
I've been working with people with disabilities for about 27 years, so I've stuck with it and I love it. I think it's been my calling. I actually couldn't have done or deserved this award without the team that I have at MCFI in Life Services.
What we hope to do, and with the team of social workers, physical therapists, occupational therapists, doctors, is to help give these people a quality of life to take them forward so that they no longer have to be a burn victim, but become a burn survivor.
It has been and continues to be my passion, not only to meet the needs of my residents and to provide better quality health care, but to make life more fun for them, more meaningful and more joyful.
What I like to do is have a brief but very meaningful friendship with the patients, and for some reason they see that in me. I come in there and it's just like we are family already, and it's just so neat that they accept me at this time of their life.
Tony loved to bowl, and my family agreed that every year we would celebrate his birthday bowling. We'd put $10 in the kitty, pay silly bowling fines, and whatever few $100s we raised, we'd give to the clinic. It was overwhelming the people that wanted to participate with us.
There are men and women out there every single day, not only in the armed services, but also in law enforcement, firefighters, EMTs, paramedics. They're out there risking their lives for you and me. And for that, I'm truly grateful.
The tragedy was the senseless act on the part of one person. Try as we might, these incidents cannot always be prevented. We must, however, be prepared to respond when they do happen, and our police and fire departments were prepared. They responded immediately with skill and professionalism.
You guys are heroes because you guys are so passionate about the progressive fields that you guys are in. You guys want to make this world a better place. A hero is defined by not the action that they take, but the reaction that they have.
Fire and police first responders, they have that sense of urgency, but they don't let it get in the way of the work that they do. In difficult circumstances, in difficult times, with challenging situations, with variables that they can't control, that you can't control every day, they respond at the highest level, in this case, saving many lives.
I'd again like to thank all the heroes this morning for all the work that you do. It's just outstanding. Let's give one last round of applause for all the heroes.